Good morning, Dr. Gupta.
Morning, Heather.
Respirologist and with University of Toronto's Medical School and our regular contributor. I'm going to bring up some pictures, Dr. Gupta, that you can see and people can see at home. Our drone going up and flying over Toronto. Look at that air. Look at what is in the air. That is what we're breathing in, Dr. Gupta. What are the immediate health risks? What are the immediate health risks attached to that wildfire smoke?
Yeah, what you're seeing there, that haze is largely made up of these tiny particles, and people will keep hearing this PM 2.5 in the news, and PM stands for particulate matter, and 2.5 is the size. These are 2.5 microns or 2.5 thousandths of a millimeter, which is why they're suspended in the air. And unfortunately, they're tiny enough that we breathe them right in, Heather, and they go deep into our lungs. And the smaller particles among them, actually they're called nanoparticles, they go straight into the bloodstream from the lungs. So you can imagine the havoc that they wreak in the lungs themselves. That's the most sensitive organ to all of this in terms of breathing symptoms, particularly people who have underlying lung conditions like asthma or COPD. We certainly see a spike in emergency room visits when we have events like this in people like that. But also, when it gets into the bloodstream, it can affect other organs. And there are studies that show a spike in heart attacks, a spike in emergency room visits for chest pain. In some studies, it's strokes, pulmonary embolism, which is a clotting type event. There's some studies that show increased risk of heart failure. There are all sorts of acute medical events that happen when we breathe this smoke in.
So that is, I mean, for sure, some people just have difficulty breathing, they have to be on a puffer or something like that, but there can be really significant health impacts because of that PM 2.5 situation. Just want to bring up, we have a graphic, I believe, to show people just how tiny it is when you compare it to the human hair. There you see it, it's on the right-hand side of the screen. That's how small, as you said, microns of this particulate matter, 2.5. We had a very interesting question from David Wood in Mildmay, Dr. Gupta, wondering about, because of PM 2.5, whether there are any comparisons done between what you breathe in with wildfire smoke and what might be the equivalent in terms of cigarettes a person might smoke. Can you draw any comparisons?
You can. I mean, obviously, it's different. There are many differences there between that burning tobacco leaf and what you have in wildfire smoke. But to some extent, there are similarities, too, because you're really talking about burning carbonaceous material. When you do that, you have the release of not only PM 2.5, you have the release of other things like carbon monoxide, sulfur dioxide, ozone. But ultimately, it's that PM 2.5 where we can draw comparisons. And if you look at BC wildfires, for example, the number was really high. It was the equivalent of smoking about a half pack a day in terms of your PM 2.5 exposure if you were out there breathing at those times. And it's probably not far off from that with what we're seeing in Southern Ontario right now.
Well, that's so interesting. I was actually, because of that question from David, diving into some research, just some recent studies from both Stanford and the University of California, Berkeley. And as we look at those numbers, you're exactly right. Depending on the air quality index, if you look at Ottawa, for example, it's the equivalent of almost 11 cigarettes a day, going down to about 3. So this incredible range in terms of this particulate matter of 3 to 11 cigarettes a day. So that also gives you an interesting indicator. We were listening to people from Ottawa there, Dr. Gupta, and you saw they are people who have to work outside, whether it's on construction site or wherever they're out and about. They have to be out in this air. What do people do to protect themselves if they have to be out in this?
Yeah, I think three things. One is if you have to go out, wear a mask. We've talked a lot about masks for the last few years. Wear a good mask with good filtering ability, and that means ideally an N95 mask to keep as many of those particles out of your lungs as possible. The other thing is reduce the amount of time. So the longer you're there and the more you're breathing, the worse it is, the more particles go in. So spend less time out there if you have to go out, and breathe less. And by that, I mean do less physical activity. The more physical activity you do, and you mentioned this, Heather, earlier, the more you have to breathe. The more you breathe, the more particles. So definitely don't exercise if you're outside, and that may be hard for someone who's in a physical type of job, but minimize that physical activity, wear a mask. And the other thing is, if you can, delay it or avoid it. And I say that because we have this thing called the Air Quality Health Index, which you can find on any weather forecast, which will actually tell you what your hyper-local air quality is like in your town, and also a forecast for what it'll be like later in the day. And so you might find that the air quality is either deteriorating or improving. If it's deteriorating, go out and do it now. If it's improving, wait if you can and go out later. So time it according to that AQHI if you can.
Chris was showing us one of his colleagues, who is Mark Robinson. He's the storm chaser for the Weather Network. He's making an extreme point here, but look at what he's showing, what he's wearing. He's got the full gas mask going on. I think he had another shot as well. But this just made me think about the questions, there we go, that we're getting from a couple of viewers. Number one, from Pat and Rob. Masks in the house left over from the pandemic. Are these types of masks effective in blocking the damaging effects of the smoke? And something similar from Jeff. What type of mask is best for smoke inhalation protection? Is a paper mask better than cloth? Should it be an N95? Dr. Gupta, is it time to bring back masks? And if so, what kind?
Yeah, you know, the good thing, Heather, is that people know a lot more about masks than they ever did before as a result of the pandemic. And like you heard on those questions, people have masks sitting around the house, which is also a good thing, and they're used to wearing them. So the answer is, you know, it's very similar to the things we talked about during pandemic. We want that mask to be well-fitting. Number one, it has to fit well. That filtering ability is a function of how much air is going through the mask and how little air you want going around the mask. So if it's not well-fitting, you're going to get a lot of air around that mask. So you got to make sure it's well-fitting. And then the filtering ability also has to do with the material it's made of. So obviously a surgical mask is going to be a little bit superior to a cloth mask, though, you know, a multi-ply cloth mask is also very good. But the best mask is going to be an N95 mask in this situation, because you really want to deal with those tiny particles, and it's those N95 masks that are blocking those tiny particles. One thing I will say that's a little bit different than COVID times, you saw the example there on the photo from your reporter wearing a mask with a one-way valve on it, so a respirator valve. That makes it a little bit more comfortable. We didn't advocate for that, and you see it right there in the middle there. That valve allows air to come out of the mask without going through the mask, but going through that easy exit valve. But it doesn't allow air to come in, so you still have to breathe air in through the mask and get that protection. And so in COVID times, we didn't want those masks because we didn't want people who had COVID to breathe their virus out of that valve and allow others to be exposed. But in this situation, you're protecting yourself against that smog, against those tiny particles in the air. So it's okay to wear those kinds of masks.
That's such an important distinction based on that photo from Mark. Thank you very much. Now, Samantha has a question related to masks, but Samantha has a toddler. And she wonders, if you have to go outside with your baby or toddler, how can you protect them? Because as far as Samantha knows, and maybe you can clarify this, Dr. Gupta, you can't put a baby or a toddler in an N95.
Yeah, it's really tricky, and I think all of us faced this in the last few years with COVID, in that we wanted to protect our children and wanted our children to be able to wear masks at school, and it wasn't always easy. You know, I think one good thing is that children are very adaptable, and many of us were surprised by how easily they adapted to it, and it just became normal for them. So hopefully there are children who are used to it. It can be challenging with toddlers. There are N95 masks for children as well, but they're not the very well-fitting N95 masks that fit very tightly, and most children probably wouldn't tolerate those kinds of masks. They're difficult for adults as well. So in many cases, the best you'll get away with is a well-fitting surgical mask for children. And if you really can't, the idea is to minimize exposure. Keep them in the home, keep them in the vehicle for as long as possible, and as little time as possible outdoors, and certainly no exercise outdoors for kids.
Okay. A question from Rita, and this is one, boy, our allergy and asthma sufferers, Dr. Gupta, have had a tough season with all the pollen in the air, and now this. Rita suffers from asthma and has now lost her voice. Wondering, can this be from the smoke?
Yeah, you know, there's a lot of irritation that can happen, and it's been well described. Irritation of the eyes, the nose, and the respiratory tract, including the vocal cords, with this kind of particulate matter that you're breathing in and out. Sometimes in asthma sufferers, voice loss can be a sign of the asthma itself, or something called vocal cord dysfunction, which can also exist in asthma sufferers. So just to be aware of that, if this is a symptom that in the past has been associated with then later deteriorating asthma control, for people to be aware of that. But otherwise, it may simply be the irritation from these particles in the air.
One of the things that we think about in telling people to stay indoors, if possible, is the quality of the indoor air. And that brings me to some questions from Betty and from Anya. In our household, Dr. Gupta, we are the proud owners of a new HEPA air filter. They have some questions about the air conditioner. Betty wondering if you can use the air conditioner to deal with the air quality problem now, and does it matter what type of AC? And similarly, Anya wondering about air conditioning and if it has to be on any specific setting for optimal benefit. Anything you want to add to those?
Yeah, the biggest thing is the filter. The filter in your HVAC system, make sure that it's been changed. People often forget to go down, and it has to be changed every few months. Particularly in heavy pollution times, you want to change it more often. So you need an HVAC system with a filter to protect yourself, or an air conditioner with a filter, but make sure that filter is changed. And as you said, Heather, you can also up your game with portable HEPA filters if required, particularly for people with underlying health conditions, or if your home is not well sealed. If air is getting in from outside, then you can do that. You can, in specific rooms, put HEPA filters that keep those rooms and that air particularly clean. And for example, in the room that you sleep in, you might want to do that, particularly if you have an underlying health condition.
That takes us to our final question. And I was thinking back, Dr. Gupta, to our initial conversation, because we covered some of this territory a couple of weeks ago when the Alberta wildfires were so significant. And we were talking at that time about the long term and looking at some of the recent data that shows wildfire season starts earlier, it lasts longer, and it's more intense while it's here. So that had us thinking about the long-term health questions and impacts. And Cam was wondering about the long term. Suzanne as well, with her question, it's a good one. Could there be long-term health effects from inhaling wildfire smoke? Lung, throat, esophageal cancers, for example. Dr. Gupta, what's your answer there?
Yeah, we've learned a lot about the effects, particularly of these tiny particles called PM2.5, and there's been so much effort to mitigate that from industry, and it's a shame because we have these massive releases of PM2.5 now every year with these wildfires. And a lot of the research into that PM2.5 does suggest long-term effects, but not necessarily with with a one-off or short-term exposure, but with prolonged and repeated exposure. And that includes, unfortunately, cancers of the respiratory tract in particular, because this is where you breathe it in. It also includes, if you look at parts of the world where there is more PM2.5, it includes cardiorespiratory disease. Things like COPD, things like cardiovascular illness are higher, and mortality is higher. People survive for shorter periods of time in those parts of the world. And, it's not entirely clear that it's only the pollution, and those are confounded analyses, but we do believe that the pollution plays an important role. And there's all sorts of effects, Heather. There was a study released this year that suggested that long-term PM2.5 exposure predisposes to earlier dementia. So many organ systems are affected, and I think we're still learning.